Philadelphia Four Seasons Landscaping Company. Big boy move. I love it. I thought to myself, people have been enjoying the medical videos I've been making. I'd pull a few strings of my own, and I'm very pleased to announce that my next medical video will be shot in front of the Ritz-Carlton. I set aside some resources, I pulled some strings, called in some favors, big bank take little bank every now and then. And I am so pleased to announce to the people that have been enjoying my medical videos that my next medical video will be, that's right, shot at the Ritz-Carlton, in front of the Ritz-Carlton. And so without further ado, ladies and gentlemen, I bring you my next medical video. So, what are we going to talk about today? We're going to talk about this new Pfizer vaccine that everybody's so excited about, which has shown 90% effectiveness. And I've seen a lot of commentary on the internet. What does this actually mean? Should we be this excited? Are they just doing this for financial reasons? Can we trust these drug companies? Can we trust these vaccines? So 90% effective, really the terminology would be 90% efficacious. Efficacy is a clinical trial term to describe an effect size in a study. Effectiveness is how well it works in the real world. Those are not always equal. Or there's the concept of proportional attribution, meaning to what extent does disease reduction result from the actual vaccine versus other factors such as patient risk factors and behaviors, baseline characteristics, demographics, etc. But for the sake of this discussion, we'll just say that, 90% effective. Does that mean that if you get coughed on by somebody with COVID 10 times, you only get COVID once? No. It means that when they run these trials, you have two groups, placebo, active vaccine, and after both are administered, it's double-blinded, randomized, and my dog is kicking me. And what they do is they just wait, and people go out into the world, and they wait and they watch as cases come in, and they have a target number of cases that they want to wait until happen, and then they look at what percentage or proportion of those cases are in the actual vaccine group versus the placebo group. And in this case, of the 94 cases of COVID in this trial, 90% of them are in the placebo and only 10% in the vaccine. More information will have to be released as to how sick people get, to what extent this reduces severity of illness in people who get it, and the side effect and safety profile, which we should have probably sometime near the end of November. If there were serious adverse events, those have been reported immediately to the FDA, so we can probably assume that side effects will be on the mild side. And I think we have good reason to be optimistic. So this is a good thing. Of course, the stock markets have responded to that. People have brought up Project Warp Speed and to what extent the Trump administration deserves recognition. Remember that Project Warp Speed has to do with the fact that these companies making the vaccine have been asked to start mass producing doses before getting FDA approval, understanding that those doses could be bunk if they are ultimately not FDA approved, and that the government will make those companies whole for those costs, so that there is not a lag time between FDA approval and widespread dose availability. It's a great idea. We really won't know if it pays off until it actually happens. So it's not Warp Speed didn't have anything to do really with providing the funding for research and development of the vaccine. It's going to be so that we have it ready to go, ready to be distributed the moment that the FDA approves it. So those are kind of two different concepts. And so, I hope people have enjoyed. We'll hopefully find out more information. And it has been great coming to you live from right in front of the Ritz-Carlton. Peace.